The following segment is brought to you by Intermountain Healthcare and the Utah Department of Health.
Suicide is a really difficult topic to talk about, but being direct can help save someone's life.
Yeah, Mary Nichols explains how you can approach the topic with loved ones.
Suicide is a problem that affects everyone, whether we know it or not. Somebody around us, whether at school, at work, at home, in our church settings, has been affected by suicide. So it's definitely everyone's concern.
Suicide is preventable. It's important to talk about suicide so people know there is help available.
QPR is for anyone. If you're concerned about a family member or a friend, QPR would be a great option for you.
QPR is a suicide prevention method. It stands for question, persuade, refer.
Basically, it teaches somebody how to recognize the warning signs of suicide, how to talk to somebody about suicide, and then how to connect them to services.
QPR trains people to directly ask if someone has thought about self-harm.
People can feel very nervous to talk about it, and so really it just gives people some practice with asking directly about suicide.
Warning signs to look for include increased use of alcohol or drugs, withdrawing or isolating from family and friends.
If you're noticing changes in a person, if they're doing things that are out of the norm or saying things that are out of the norm for that person, or their moods are different than usual, that's really what you want to clue into and then ask them about suicide.
It's crucial to understand that talking about suicide will never plant the thought.
That's a huge misconception. If we ask about suicide and somebody is thinking about it, it's actually going to lower anxiety and lower the risk of an impulsive act.
Mary Nichols for Check Your Health.